What do the tiny squares on the EKG paper's horizontal axis represent? A. 5 seconds. B. 0.04 seconds. C. 0.2 seconds. D. 0.1 seconds. Occurs when cardiac muscle is deprived of oxygen, causing the tissue to perish. A. Cardiac palpitations. B. Myocarditis. C. Myocardial infarction. D. Paroxysmal tachycardia. The heart pumps in a single circulatory cycle? A. Only blood nutrients. B. Mixed blood. C. Deoxygenated blood. D. Oxygenated blood. Hypothermic patients would display a body temperature that is A. Within normal limits. B. Below normal. C. Above normal. What effects does the parasympathetic nervous system have on the heart, and which receptors are involved? A. Constriction of arteries, cholinergic receptors. B. Dilation of arteries, cholinergic receptors. C. Dilation of arteries, alpha-1 adrenergic receptors. D. Constriction of arteries, alpha-1 adrenergic receptors. What do you call the waveforms in the middle of the lines? A. Waveform. B. Interval. C. Segment. D. Complex. What is the PR segment? A. Ventricular depolarization. B. Atrial depolarization. C. Depolarization of AV node and its delay and depolarization of bundle of His and bundle branches. D. Atrial repolarization. What does the QRS complex represent? A. Septal depolarization. B. AV depolarization. C. The depolarization of ventricles. D. The depolarization of atria. What is the correct ratio of breaths to compressions in CPR? A. 2 breaths to 15 compressions. B. 2 breaths to 30 compressions. C. 1 breath to 30 compressions. D. 1 breath to 15 compression. The correct lead for the fifth intercostal space, midaxillary line on the left side is A. V1. B. V3. C. V4. D. V6. What's the amount of blood pumped into the aorta each minute by the heart called? A. Stroke volume. B. Venous volume. C. Cardiac output. D. Ejection fraction. What's the ST segment? A. Delay in the atrioventricular node. B. Ventricular depolarization. C. The pause between ventricular depolarization and ventricular repolarization. D. Atrial depolarization. Myocardial infarction occurs when blood flow to the heart muscle stops or is suddenly decreased long enough to cause cell death. A. True. B. False. What's the major intracellular ion? A. Sodium. B. Potassium. C. Magnesium. D. None of these. What's the major extracellular ion? A. Sodium. B. Potassium. C. Magnesium. D. Calcium. What's the location of the sinoatrial node? A. Right atrium. B. Right ventricle. C. Interventricular septum. D. Purkinje fiber. Ventricular diastole refers to ventricular. A. Contraction. B. Relaxation. C. Filling time. D. Pressure ratio. Which of these is a major stage of activity in the cardiac cycle? A. Inflow. B. Isovolumic relaxation. C. Ejection. D. All of these. There are per minute in a normal, healthy heart. A. 72 cardiac cycles. B. 82 cardiac cycles. C. 81 cardiac cycles. D. 72 cardiac cycles. What portion of the EKG represents the duration of ventricular systole? A. QT interval. B. PR segment. C. QRS complex. D. ST segment. The left side of the heart is referred to as a high pressure. A. True. B. False. One cardiac cycle occurs every A. 0.8 seconds. B. 0.5 seconds. C. 0.52. D. 1.2. Which of the wouldn't be a cause or reasons to stop the exercise electrocardiography? A. Patient is complaining of shortness of breath, chest pain or dizziness. B. Patient's heart rate is considered normal. C. Physician observes blood pressure, EKG or heart rhythm changes that are not perceived by the patient. The PR portion is what? A. Atrial repolarization. B. Ventricular depolarization. C. Atrial depolarization. D. Depolarization of AV node and its delay and depolarization of bundle of His and bundle branches. ST segment depression indicates A. Subendocardial type of myocardial ischemia. B. Coronary artery block. C. Subepicardial ischemia. D. Ventricular hypertrophy. What does the parasympathetic system do to the heart, and what receptors are associated with it? A. constriction of arteries, alpha-1 adrenergic receptors. B. Dilation of arteries, alpha-1 adrenergic receptors. C. Constriction of arteries, cholinergic receptors. D. Dilation of arteries, cholinergic receptors. An RR interval represents what on the EKG? A. 2 complete cardiac cycles. B. Rest and relaxation. C. 1 complete cardiac cycle. D. Inferior MI. How many electrodes are used in Holter monitor? A. 10 electrodes. B. 6 electrodes. C. 11 electrodes. D. 5 electrodes. What is the correct order of the chain of infection? A. Means of transmission, susceptible host, source. B. Source, means of transmission, susceptible host. C. Susceptible host, means of transmission, source. D. All of the above. In which leads would you see a positive P wave? A. 1, 2, 3. B. AVL, AVF, V4, V6. C. V4, V6. D. 1, 2, AVL, AVF, V4, V6. The 12-lead EKG reveals ST elevation in leads V1, V4. Where is the MI? A. Inferior. B. Anterior. Where does the R wave exceed the S wave in size? A. Lead V2. B. Lead V1. C. Lead V4. D. None of these. Treatment for atrial fibrillation. Atrial flutter may include which of the following? A. Blood thinners. B. Nitroglycerin. C. Beta blockers. D. All of the above. First-line treatment of ventricular fibrillation is A. Digoxin. B. For fluid bolus. C. Defibrillation. D. Cardioversion. Treatment for a conscious, asymptomatic patient with ventricular tachycardia could include which of the following? A. Procainamide. B. Lidocaine. C. Amiodarone. D. All of the above. When the patient with ventricular tachycardia becomes symptomatic but still has a pulse, which treatment is appropriate? A. Defibrillation. B. Cardioversion. Which one of these is not visible on an electrocardiogram? A. Presence of asymptomatic blockages in the atria of the heart. B. The function of implanted pacemakers. C. The size and position of the heart chambers. The most common cause of premature ventricular tachycardia, PVCs, is A. Hypocalcemia. B. Hypoglycemia. C. Hyperkalemia. D. Hypokalemia. What is the most accurate method for acquiring heart rate? A. 6x10 method. B. 1500 method. C. QRS method. D. 300, 150, 100, 75, 50 method. As an impulse moves toward a positive electrode, it produces what type of deflection? A. Upward. B. Downward. C. Flat. D. Negative. On ECG papers, horizontal measurements are used to determine what? A. Electrical voltage of the waveforms. B. Amplitude of the waveforms. C. Cardiac output. D. Heart rate. The initiation of the impulse in the SA node and its movement through the atria produce A. Wave. B. PR interval. C. QRS complex. D. Wave. Repolarization of the ventricles is represented by the A. Wave. B. ORS complex. C. T wave. D. R wave. Artifact is A. Produced by chaotic electrical activity found in the heart. B. An easier way to interpret rhythms. C. Usually consistent across the rhythm strip. D. Problematic because it can mimic life-threatening dysrhythmias. Two PVCs in a row are called A. Double. B. Couplet. C. Trigeminal. D. Salvo. The heart valve that is situated between the right atrium and the right ventricule is called A. The pulmonic valve. B. The mitral valve. C. The aortic valve. D. The tricuspid valve. Automaticity means A. The ability of the myocardial cell to contract when stimulated by an electrical impulse. B. The ability of certain cells to produce an electrical impulse without the need for outside nerve stimulation. C. The ability to transmit an electrical stimulus from cell to cell throughout the myocardium. Each small square running horizontally represents A. 3 seconds. B. 4 seconds. C. 5 millimeters. D. 0.1 mV. The third step of analyzing an ECG rhythm is A. Evaluate the QRS complex. B. Determine the heart rate. C. Determine the regularity. D. Evaluate the wave. The PR intervals get progressively longer in A. First-degree AV heart block. B. Second-degree AV heart block, type 1. C. Third-degree AV heart block. D. Sinus dysrhythmia. A heart rate below 60 is called A. NSR, B. Bradycardia, C. Tachycardia, D. Fast. Trial fibrillation has A. Longer PR intervals, B. Irregular rhythm, C. No waves, D. No QRS complex. What is the dominant ion inside cells? A. Magnesium, B. Potassium, C. Sodium, D. None of these. The V3 should be placed as follows. A. Directly between leads V2 and V3. B. Directly between leads V3 and V4. C. Directly between leads V1 and V4. D. Directly between leads V2 and V4.